The broadcast is now starting. All attendees are in listen-only mode.
Hi, how is everyone today? My name is Nick Vusick, and I do government affairs here at Child Care Aware of America. I'm going to talk to you about a very confusing subject today. It's about what I like to call the budget bonanza, which is what some are calling the new and improved fiscal cliff. Throughout the presentation, if you have any questions, there's a little box you can type them to, and at the end of the webinar, I'll try to answer anything you can ask. So, I first like to start off with one of my favorite cartoons about this entire thing. There's a lot of confusion out there. There's a lot of different terms that everybody's calling it, but I think the bottom of this cartoon has it perfectly summarized what's going on. And you can see one guy asking, do you think they'll figure it out? Another guy asks, maybe if somebody could actually explain the problem. And that's a problem we're experiencing not only with people who are experienced with budget policy and tax policy who are inside the Beltway, but if they're having trouble understanding what's going on, it's hard to imagine what a working family or a provider, or resource and referral agency, or anyone else, may try to understand. Well, I guess the first question most people are asking is, didn't we just avoid going over the fiscal cliff? I mean, didn't we just spend the end of December and the beginning of January hearing all about this? Just to review a little bit about where we were, in August 2011, Congress reached a budget deal. And part of this budget deal included this condition that the failure to reach an agreement before January 2013 on alternative ways to reach a deficit reduction through different targets without triggering an across-the-board cut meant that, so basically it was called the Sequester, as you may have heard, once or twice, and if a deal wasn't reached before January 2013, this massive across-the-board cut that would last over 10 years would occur, and it would cut about $85 billion from both discretionary and some mandatory programs, but mostly discretionary. So what happened in early January? Congress was able to pass a short-term fiscal cliff deal. The main parts of this deal were automatic spending cuts were delayed for 2 months, so the Sequester, which would impose steep across-the-board cuts to domestic and defense programs, was delayed for 2 months until March 1st. There's a 1-year extension to unemployment insurance, which meant that emergency unemployment benefits will be extended for a year. The 1-year doc fix, which was a measure that delayed scheduled cuts in physician payments under Medicare. In the absence of an agreement, the payments were going to be reduced by 27% in January, which was a big hit to many Medicare physicians. And then there's also the 9-month extension of the Farm Bill, which was a much-feared spike in milk prices, also dubbed the dairy cliff because it was also set to kick in abruptly on January 1st, which was averted through a 9-month extension of some parts of what was called the Farm Bill. Additionally, there is a permanent fix to the alternative minimum tax, which is a tax that was created to ensure the wealthiest Americans paid a fair share of taxes. It was not tied to inflation, but it was also part of the deal. And then lastly, there is a large part of tax breaks for working families continued. The deal included 5-year extensions of the American Opportunity Tax Credit, which can be claimed for college-related expenses, the Child Tax Credit, and the Earned Income Tax Credit, which was a refundable income tax credit for low to moderate income working Americans. Well, people are asking, well, if that's all the fiscal cliff, then what's to worry about? We avoided our problems, right? Unfortunately, the fiscal cliff deal did not solve many of the problems facing the government, but delayed them in order to have more time to work on a larger, more effective solution. Some of the lingering items left on the table include hitting the debt ceiling on February 15th, the date estimated by the Treasury. The debt ceiling is a very important term in current politics because it is the authority for the government to borrow money and function. In other words, we can't pay our debts if the debt ceiling is not raised. Additionally, the imposition of the first round of sequester cuts, totaling about $85 billion on March 1st, is set to take place, which was kicked down the road from January 1st, or January 2nd. And then on March 27th, the fiscal year 2013 continuing resolution expires, which, if not extended, would halt funding for non-essential government services. It's important to remember that the continuing resolution is a funding bill passed in September to provide funds for federal programs for 6 months. This was necessary because Congress was not able to pass the full-year appropriation bill by October 1st, when the new fiscal year began. So that 6-month bill needs to be addressed before it expires so that decisions can be made for spending the remainder of the year. Additionally, the Temporary Assistance for Needy Families Program, TANF, as you've probably heard it referred to, expires on March 27th, but will most likely either be renewed or extended once again. TANF provides states with block grants to assist families living in poverty. Well, part of the solution to the new fiscal deal is currently in play, is a bill to increase the debt limit, which is the first part of the entire thing. One provision of the bill would temporarily suspend this debt limit through May 18, 2013, and on May 19th, the debt limit would then be automatically increased by the amount of debt necessary to fund commitments by the federal government. So it would allow the government to continue to pay the people they currently owe debt to. The entire next part, the sequestration, was a main part of the January 1st deal. But going back a little farther, it was created by the Budget Control Act of 2011, which also formed a congressional super committee that was instructed to agree on at least $1.2 trillion worth of deficit reduction. Additionally, as a fail-safe, it included automatic cuts to defense and non-defense spending that would be implemented if the super committee did not meet its target, which is what we refer to as the sequester. Now that such an outcome has materialized, the across-the-board cuts are scheduled to go into effect without congressional legislation that waives or postpones them. So, in other words, on March 1st, there's going to be large across-the-board cuts unless Congress acts. Additionally, because no individual appropriation bills were enacted for FY 2013, which began on October 1st, 2012, all federally programs are funded through March 27th, which is what we refer to as a continuing resolution at the same level of funding as in FY 2012. Additionally, the last part, TANF, which I talked about before, is a block grant that funds a wide range of benefits and services for low-income families with children. When Congress passed the continuing resolution in October, it included a 6-month extension of the TANF program, which was set to expire. For grants to states under TANF to continue beyond March, Congress would need to either pass another short-term extension or a long-term reauthorization, which is what we're hoping for. Going into a little bit more about what I talked about before, which was a proposal to increase the debt limit until May 19th. The House Republicans put out a proposal. It passed in the House 285 to 144, and it today is actually currently being considered on the Senate floor to be passed this week. Upon enactment of the bill, the debt limit would be temporarily suspended. On May 19th, the debt limit would then be automatically increased by the amount of debt above the limit necessary to fund the government. A part of this deal also included a stipulation that pay for members of Congress would be temporarily withheld if a budget resolution is not passed by their chamber on or before April 15th. A lot of people are asking, what's the budget resolution? That's a great question. A budget resolution is an internal management tool like a blueprint for committees to follow in making spending and saving decisions. It sets targets and imposes discipline if those targets are not met. The next part touches on revisiting the sequester. So, we talked a lot about what the sequester means now and how we got here, but a little bit more about the way it's constructed. This chart, as you can see, with information by the Congressional Budget Office, shows the 10 years worth of budget cuts by the sequester as a result of the Budget Control Act of 2011, with the first set of cuts originally set to take place on January 1st and 2nd of 2013. The Fiscal Cliff deal delayed the start of date for cuts until March 1st, 2013. As the charts show, the total cuts over 10 years equals about $1.1 trillion, with the majority of cuts to discretionary defense funding and discretionary non-defense funding, which does include the Child Care and Development Block Grant. So a little more specifics on what programs could get cut by the sequester. The sequester differentiates between mandatory and discretionary programs. Most discretionary programs, those that are subject to the annual congressional appropriations process, would experience automatic cuts under the sequester. Many discretionary programs provide critical supports for children and families. Mandatory programs, those entitlement programs not subject to annual appropriations, Medicaid, the State Children's Health Insurance Program, SCHIP, Social Security, TANF, SNAP, or food stamps, some child care money, and the child nutrition programs are generally exempt from sequestration. If Congress does not take action, the following impacts could be felt by children and families. 80,000 fewer low-income children would receive child care subsidies through the Child Care and Development Block Grants. 96,000 fewer poor children would receive comprehensive early child education services in Head Start. Almost 27,000 fewer infants and toddlers would receive early intervention services through IDEA Part C. Almost 150,000 fewer students would be served by the 21st century community schools. 1.8 million fewer disadvantaged students, including some preschool-age children, would receive education services through Title I of the ESEA. And finally, 5 million fewer families would receive help with maternal and child health services through Title V of the Maternal and Child Health Services Block Grant. As you can see, these are some pretty large effects that, in addition to the state cuts that are happening in most state budgets, would really have a pretty deep impact on a lot of children and families. Well, the next part of the new budget problems is what's referred to as the expiration of the continuing resolution, commonly referred to as the CR. The continuing resolution provides funding through March 27, 2013. Typically what a continuing resolution is, it's a type of appropriations legislation used by Congress to fund government agencies if a formal appropriation bill has not been signed into law by the end of the congressional fiscal year. The legislation takes the form of what's called a joint resolution and provides funding for existing federal programs, typically at reduced or current levels. So the way it works is that the federal government of the United States operates on a budget calendar that runs from October 1st through September 30th. Each year, Congress determines funding for each department, agency, or program to spend a specific amount of money, and the President signs the bill into law. These bills are referred to as appropriation bills. Congress passes 12 appropriation bills every year to ensure the operation of the government. If Congress fails to pass such a bill, or the President fails to sign it into law, non-essential functions of the government will cease. In order to prevent the interruption of government services, Congress will often pass a continuing resolution. This means that the government agencies will continue to be able to fund their agencies at the current level until either their resolution expires or an appropriation bill is passed. A continuing resolution must be passed by both houses of Congress and signed into law by the President. The current continuing resolution was good for 6 months, and therefore that's why Congress needs to pass either another extension with a different appropriation bill to provide funds for the remainder of the current fiscal year. And finally, the big question that everybody's asking, is this going to affect me? Yes. As I mentioned before, if you look at sequester cuts, there's some pretty deep cuts there. But the main difference between the Fiscal Cliff deal or the Fiscal Cliff that was coming at the end of the 2012 year and beginning of 2013 versus this is that the original Fiscal Cliff dealt largely with taxes. There's a lot of emphasis on, tax increases that were going to affect all Americans. Part of these were the AMT, which I mentioned briefly, but there's a lot of taxes that the payroll tax holiday, among others, that every American would have felt. This time, it's a lot about cuts to programs that Americans depend on. And a new deal could include another congressional pay freeze. The lack of a deal could mean a government shutdown, and the lack of action on the sequester would mean approximately $85 billion in spending cuts taking place on March 1st. Well, and the big thing is we want to let you know what some of the things you can do to help out. The more important things you can do is educate your members, staff, neighbors, and friends about the fiscal crisis and the potential impact on your work. Another thing that we advocate strongly for is setting up meetings with members of Congress in their district or state and inform them of the potential harm from further reductions in domestic discretionary spending to let them know how this is going to affect you and in return how this is going to affect them. Write op-eds and letters to the editors of their local papers about the fiscal crisis and the threats to key programs affecting children and youth. So, get the word out there in your community, letting them know why this is an issue for you and what you think should be done. And, of course, consider becoming more active in campaigns to prevent reductions in domestic discretionary spending in key programs affecting children. There's a lot of organizations that we partner with running parallel campaigns to help make sure these cuts don't go into action. So we always recommend, working in your communities, working with different organizations as well as working with us to help make sure these cuts don't become reality. So that's just, a very brief introduction to the very complex world of the United States congressional budget process. If you have any questions, please feel free to type them in the box on your screen, and I will be happy to answer them. Well, I see one question coming in here. It's talking about the timeline for everything. I'm going to actually, these slides will be available. So just a brief review of the timeline is the first part, if not acted on, will be the debt ceiling, which takes place on February 15th, so only in 2 weeks here. The next part will be the sequester cuts, which take place on March 1st, or set to take place on March 1st. And then the next part is the expiration of the continuing resolution for FY 2013, which will take place on March 27th, which will also include the expiration of TANF, which is on the same date. But as I mentioned, if the House resolution or the House bill that passed the House passes the Senate, the debt ceiling will be pushed back to May 19th. All right. See if there's any other questions coming in.
Hi, this is Grace, and I'm the Chief of Policy and Evaluation. One question came in, which maybe many of you are thinking about how it applies specifically to a program you may work on. The question is, well, I heard about the across-the-board cut, but what does that mean for child care? I think whether it's child care or whether it's Head Start or whether it's maybe, mental health services or education K-12, the real answer is right now we really don't know. The estimates are that the across-the-board cut on basically funding for social services will be about 5%. But that happens at maybe an agency level, and whether that's going to happen program by program is kind of a question. What we know is O&B has asked the agencies to take a look at their budgets and figure out, how these across-the-board cuts would work. In the case of the Child Care and Development Block Grant, it's actually a little bit more complicated because the money is a block grant that goes to the states. So let's say HHS were to cut that funding, which is about $2 billion, by 5%. So 5% less money goes out to the states. How does the state absorb that cut? We don't know. I mean, will that affect the quality set-aside? Will that affect funds for training? Will that affect funds for licensing? Will that affect funds for quality rating systems? Or will that affect slots, the number of families that are served, or eligibility? All of those are important questions, but all of those questions can only be answered by the states in kind of a if-then statement. If the cut happens, then we have these 10 different options to absorb the cut, and each state may make those decisions, in a different way. A state with a long waiting list could make a decision differently than a state that is somehow meeting the needs of all families who have applied. So we're going to continue to stay on top of whether or not the sequester or across-the-board cut will happen, and what the impact is, and what we learn from the states about if it does happen, how they deal with it, so that everybody has a good understanding. But right now, we know the broad concepts, but we don't know exactly how it will be implemented.
And we got a great question in asking, has Congress ever let TANF expire before, and what do you think is the real possibility that this program will end?
I really don't think the program's going to end. It's $16 billion that goes to the states since 1996. Have there been temporary lapses? Maybe, but very, very short. Just like Congress is supposed to pass 12 appropriation bills every year, there are certain programs like TANF that are called mandatory because they're what's called entitlement money to the states. They're not entitlements to individuals because each state sets eligibility, but the money generally, goes to states. States decide who's eligible. I don't think that TANF will expire. I think what's likely for TANF, because it's exempt from the sequester, it's one of those mandatory spending programs with people who are entitled, people who get the money get it based on state rules, but the block grant itself is an entitlement to the states. I don't think there'll be a lapse. I think, like the appropriation bills, it will likely be extended in some way. Same with food stamps, same with child nutrition, same with Social Security. I mean, those things tend to happen, be extended, because obviously they affect a lot of people. So we're waiting to see if we see any other questions. And we don't at this point.
So if you have any questions, there's an email on this slide. If you want to ask any questions that you didn't have the chance to, or you review it, or look at it on a later recording, you can email me personally at any time. My email is included on the slide that's currently up. And we appreciate having you on this webinar, and hope you understand a little bit more about what's going on with the budget right now. Thank you.